Welcome back to Crazy Stupid Midlife with Renee and Dannielle, where we are rebranding midlife one episode at a time. Okay, so today we are talking hormones because let's be honest, mine are more unpredictable than my daughter, who's a teenager right now, super unpredictable.
I mean, same, but here's the thing. We don't need to have hormones be the enemy here. We're going to just talk candidly about hormones. I'm going to give my expertise and both of our experiences. We'll talk about those. And Renee, do you want to give us a stat here, which is interesting about women going through menopause?
Yeah, actually, I think this is really crazy. So I'm going to open up with a global stat. Over 1 billion women worldwide are expected to be in menopause by 2025. And yet many still feel confused, overwhelmed, or even ashamed to talk about it. And today we really want to break that silence.
That's 1 billion women, half the population. I don't even know what the population is, but I mean, there's men and women. So that's a lot. I just want to say this conversation is for informational purposes only. It's not intended as medical advice. Every woman is different and should work closely with a licensed medical professional for a proper diagnosis, a full history, and shared decision making whenever talking about your health or hormones or whatever it is. So, this is all just for informational purposes.
And everyone's different too. I think it's really important to note that too. So what I go through is going to be different than what Danielle goes through, and that goes for the rest of the population. It really depends on your history and also your family history with, your mother and your grandmother, and so it can really vary. And so one size does not fit all for sure when it comes to hormones.
Absolutely. We're
So
all made differently.
yeah, exactly. And we all have different, things that affect the way we go through perimenopause and menopause. So let's start with the 2002 Women's Health Initiative because I think that's the best place to start. What happened and why did it scare so many women when it comes to hormone replacement therapy?
So, this study is really controversial because people were using hormone replacement therapy to help with hot flashes and menopause symptoms back in 2002. Then this study was done, the Women's Health Initiative, and it came out and they're saying that there is a link to hormone replacement therapy that it increased the risk of breast cancer, heart disease, and stroke. Well, a couple of different things. It went out in the media, so it just scared everybody. Practitioners and everybody just said, "Oh my God, everyone has to stop using hormone replacement therapy and we can't prescribe it anymore." So for the last 20 years, it's scared everyone away. So all these women, the baby boomers, have been suffering. They have not been given or offered HRT until now. There's a lot of studies debunking this one. So that study was specific to starting hormone replacement therapy when you're older. So those women were in their 60s and 70s. Some of them probably already had diseases, or they didn't measure that in their medical history. So other studies have come out debunking it. So hormone replacement therapy, and do your own research as well. Always look up everything so that you can take
Right.
your pearls away from that. Don't take anyone's word for it. Just always do your research. It's all out there on, you can Google peer-reviewed articles so that they're tested. So basically, we don't even use the same hormones we use today that we used in those studies. So now we use bioidentical hormones. And these are hormones that are made like our body makes already. And so these are different from a birth control hormone, and the amount is also very, very small. So it's different than what was also studied back at 20 years ago. So
Okay.
that's what the Women's Health Initiative was, a 2002 study. That one has been debunked. It does not cause breast cancer.
Yeah, that's when I was doing my own research too before we started, with the idea of doing the podcast. I had read a lot about that. And the age thing was what I remember reading about the most. So that's why they're saying, early intervention on HRT is best. And I think women, they try to get through it as long as possible without going on hormones. And then by the time they're, at their wits' end, their doctor might say something like, well, you're kind of too old for hormone replacement therapy and just, hang in there until you hit menopause. But again, that can be a 5 to 10 year span of time. It just really varies. And there's no true measure to know when someone's going to finally hit menopause, right?
No, and the average age is 51. And true menopause means that you have not had a period for 1 full year. That is how we categorize a true menopausal woman. But that means that your hormones have decreased so much. So that brings on a whole nother slew of symptoms and issues that you have to tackle once you're in true menopause. And if it's at 51, I mean, that's pretty young.
Mhm.
Hormone replacement is now you want to start it early on when you're in perimenopause. And some people continue on forever. Some people continue on until they're through their seven. It just depends on every single person. And that's why everyone is different. Everyone's situation is different. And I think I read something that you just need to outweigh your risks and benefits. And that's what you have to do that with your provider. I mean, it's just like it's not the same, but it's similar where you drink alcohol, that's a risk. We take a risk when we drink alcohol. We know that a lot of alcohol and obesity, all of that causes cancer at some point because you're unhealthy. And so it's all a risk and benefit. So you just have to see where you lie in that.
Okay, so today I was at the gym and I was talking to a couple of friends of mine, and I said, tonight we're recording an episode on HRT. And my good friend, who's also my age exactly, she said, "What's HRT?" And I thought that was so relevant because when we were talking about this episode, I said, let's just call it HRT. And you said, well, not everybody knows what HRT is.
Right.
And so that leads me to my next question. What even is HRT and why should we care?
Some women don't have any symptoms. So your friend probably doesn't have any symptoms, or she's not realizing that it is a symptom of perimenopause. So hormone replacement therapy is for people that are having so many symptoms that it's life altering for them.
Yeah, it's
And
impacting life.
exactly. The quality of their lives is decreasing. For example, let's say you're having night sweats. So you're having hot flashes, night sweats, and then you can't sleep. Well, that right there, no sleep alone
Mhm.
is horrible for your health, right? You need to have a balanced diet, exercise, and sleep.
Your
Well,
mood.
if you can't sleep, yeah, your mood is affected. You don't want to work out. You definitely don't want to eat healthy. So it's just kind of like a domino effect. Hormone replacement therapy is an option to help with those symptoms. Now, as we age, we get into perimenopause, we lose estrogen and progesterone. So when those hormones are going down, estrogen, it is responsible for so much sleep, mood, libido, hair loss. I mean, the list is so long. I think there's like 200 things that could be happening that you don't even realize that it's coming from your age. HRT is something can help with symptoms of midlife, of menopause, perimenopause. So that's why it's an option.
And to be clear, HRT is just an acronym for hormone replacement therapy. And also, another acronym out there is BHRT, which is bioidentical hormone replacement therapy, which I think you had just said. That's essentially
That's what we
the,
use because it's not the old hormones that we used to use back in the day. It's now bioidentical, which means it's made similarly what you produce already in your body. So if you're losing estrogen, we're trying to bring up those estrogen levels to where you don't have symptoms.
okay. So, next question. Who is a candidate for hormone replacement therapy? Can anyone take hormone replacement therapy?
No, not everyone can take hormone replacement therapy. A healthy woman who exercises, has a balanced diet, and who is experiencing symptoms, that's who's good for HRT. If you've had a history of breast cancer
Mhm.
yourself or breast cancer in your parent, most like your mother or aunt or sibling on your maternal side, that gives you a higher risk. But it doesn't cause breast cancer. Some cancers are estrogen dominant. So that's when you'd want to stay away from any hormone replacement with estrogen. So people are not candidates. Also, if you have a clotting problem or a risk factor for stroke, you're not a good candidate for hormone replacement therapy. This is why it's very important to speak to a practitioner who is well versed in hormone replacement therapy, and your history is important to take. Now, a lot of times we go off symptoms. So some people will say, well, I've had my hormones checked. I've been to my doctor and my OB and they said everything's fine. Well, what we don't understand is when we look at labs that have been drawn,
Mhm.
and it's your age is stated. So if you're 48, your hormones are probably normal for a 48-year-old. That doesn't mean you're functioning at your best potential at that level. So it's a decrease and it's an average of where your hormones would lie at a 48-year-old. So that doesn't mean that you're you're not having any symptoms and that you're not going through perimenopause or shouldn't be a candidate. You're definitely a candidate if you're a healthy woman.
Okay, I had a question about something that you just said, and of course, it's gone. It'll come back. It'll come back. You were talking about a healthy
Who's a
woman
candidate? Can
who's a
anyone take
candidate.
HRT? No, they cannot.
Yeah.
If you can't take hormone replacement therapy, I mean, is it just, oh, well, and then I have to have a shitty 5 to 7 years? No. There's other things you can do. So they're finding that SSNRIs or SSRIs and Benton are helping um, for hot flashes. Those are some of those are SSRIs and SNRIs are mental health medications. So those are helping with hot flashes and sleeping. Gabapentin is a nerve medication they give for seizures and things like that, and that's also they're finding is helping because it helps cut down on the receptors and things like that are happening in your body. So there's other things you can take. If you don't want to do medications, there's alternatives also. There's natural remedies. But the best thing you can do for anybody before you even start any kind of HRT is balanced, healthy diet, working out and exercising. Those two things, that lifestyle is going to take you further, especially in midlife.
Yeah, I agree with that for sure. I used to read about this and I would always kind of like roll my eyes about it because I felt like when people would say, do things to reduce your stress or to manage stress. Because to me, I would read that and think, that's so vague. Like, what do you mean? What am I supposed to do to reduce my stress? But I think what it means now that I'm in midlife and I'm trying to prioritize all the recommendations that you hear out there is find something that does reduce your stress and implement it into your daily life.
Yeah.
So I'll give an example. For me, I love to journal. I journaled as a child, I journaled as a young adult and as an adult. And journaling does help me reduce stress. When I journal, I feel better. So I have tried now to incorporate that into my daily life because it helps reduce stress. And I think that's another thing that we have to add on to eating healthy, exercising, and find a manageable and implementable thing you can do in your daily life to reduce your stress, whatever it is, having a cup of tea at night before you go to bed, doing some yoga stretches before you go to bed, reading a book before you go to bed, or, winding down with a good show or whatever. We have to make sure we're doing that on a daily basis instead of waiting until we're really miserable to do something to reduce our stress.
And with the hormone fluctuation, it's really hard to feel steady. So, like, yes, we love to work out. Yes, you should be working out. Yes, you should eat a balanced diet, but give yourself grace. I mean, I love to do all those things, but it's really hard to do it all the time. And realistically, I mean, our lives are crazy. You're moms, you're working, whatever it is, there's a lot going on. So, like you said, if you can just find something that makes you happy and gives you a little bit more balance, that's good. But know that give yourself grace too, because it's not always going to be that way. You're not always going to nail it when you work out. You're not always going to journal. You're not always going to be able to do it, but most of the time do it. Just, it's not 100%, but maybe like 80-20. So
Hmm.
give yourself some grace. It's some days are hard to even get out of bed. So that's realistic.
Yeah, I agree with that for sure. Okay, so we just talked about reducing stress. So that leads into a great next segment on how hormones affect mood and behavior. And my question is, why do our hormones make us feel like we're losing it sometimes? I was going to say something else. I'll keep it clean.
Well, it's
Why
the
do our hormones
losing our
make
shit.
us
Why
feel
do we always feel like we want to
lose?
lose our shit?
Yeah.
It's just a hormone
What's happening?
imbalance. It's just like when you're a teenager and you're getting surges of hormones.
Mhm.
Instead of an in surge, we're getting a drop. So it's up and down. We're still going up and down in hormones. They're still fluctuating. So it's the same, but the opposite direction. For example, progesterone is if you think about it like this, estrogen and testosterone are the gas. They give you gas in your body. So energy, libido, it helps fight depression. You'd have more go-getter kind of feelings. Progesterone is the brakes. So it's going to help calm you down, less anxiety, help you sleep. Just so those are fluctuating all the time as we're going through perimenopause. If the goal for HRT is to bring it to more of an equal state, so we're not going on this roller coaster consistently. So it's just more steady. And so the rage comes from dropping. It's just going down. And
Mhm.
we need to add the hormone back to feel, I don't know if normal is the word, but just more like ourselves, because that's not normal to feel like that all the time. It's not normal. It's not fun, and we don't need to suffer. You just don't need to feel like that all the time. If you're a candidate for HRT, you can try it. It's all trial and error. Every body is different, and like, let's talk about your story, Renee. You tried it, and what happened there?
Well, a lot
Right.
happened. I don't know if we wanna get into mine right now, but, I mean, we can.
Yeah,
Should
just
we?
I mean, because this is a good segue. It's not for everybody. That doesn't mean you can't try again, but let's
Yeah, I was just gonna say that. It doesn't mean that I won't try again, but I think, well, I mean, I'm still having a period, and I think that's also relevant because some women at my age are no longer having a period. You know what I mean? I have friends that the two friends who I, go to the gym with, both of them aren't having a period, and I'm having a period every month, and I have a short cycle, so like a 28-day cycle in between your period. Mine's more like 25, 24, and I have a long 7-day period. So I went on HRT. I went on estrogen patch, which we should probably touch on that too. How, before I say it, how do people go on hormones? Is it a pill? Is it a patch? Is it a cream?
well, all of that. So there's different types. So hormones also include, so it's progesterone, estradiol, and testosterone. Those are typically the ones that are prescribed to balance your hormones. Testosterone is not FDA approved for women, so we have to get it compounded. It's only FDA approved for men, which is amazing. So we get it compounded and it's a cream. So you either put it on your wrist or your inner thigh, or you rotate every day. Estrogen or estradiol can come in a patch, or you can do pellets. Pellets also, testosterone can come in pellets too. So pellets is another option where they put the pellet into usually it's on your upper buttocks area. They cut a little slit and they put it in, they inject it and it stays in there. Depending, sometimes it's 3 or 4 months, and then you have to get them it's a slow release, and then you have to get them re-put in every so often. That's an option. But pellets are out of pocket. Pellets are not covered by insurance. So you would have to pay, I mean, five, six, seven, $800 every few months to do your pellets. And testosterone cream is also not covered. So you'll have to pay out of pocket maybe $120 for the cream a month, give or
Okay.
take. And then progesterone is an oral pill that you take every day, covered by insurance if it's prescribed by your practitioner or healthcare provider. And estrogen or estradiol, it comes in a patch that you replace usually every 3 or 4 days, and that comes in different strengths. So the patch is great. Estrogen also comes in a cream form and also the pellet. But progesterone is usually oral. That's how it's best taken for the specific progesterone. And usually estrogen and progesterone go together if you have a uterus. So if you have not gotten your uterus taken out for any reason, then usually you're taking both of those together, and they balance each other out because progesterone can help with uterine cancer. So it's protective of that when you're on estrogen. Did I cover all of them?
Yeah,
I think
I
so.
think so.
Yeah.
So I thought that was a good lead into what I was doing. So I was doing the estrogen patch where I alternated the like upper butt cheek area every 3 or 4 days. And I started off on the very lowest dose. And then I was also taking progesterone at night, also very lowest dose. And so I felt like maybe it was helping with my mood and my irritability. My nurse practitioner recommended me going up just a little bit on the estrogen because I felt like I was better, but I wasn't back to where I felt I needed to be so that I was happy.
What symptoms were you having?
I was having night
Why did you
sweats.
want to do HRT?
Yeah, night sweats, irritability, anger, rage. It was mainly for the mood.
Yeah.
It was mainly for the mood and the night sweats. I wasn't really having hot flashes, and I feel like I need to knock on some serious wood
Yeah.
because that's important. I never really had a hot flash during the day. I mean, sometimes I would get hot, but I felt like that was kind of normal. I run a little bit hot, but I never was like sweating and sweat beating off of my face because I've seen friends have hot flashes right in front of me and it looks like they're on fire.
Yeah.
But the night sweats were affecting my sleep, and I was also having, like, I would wake up in the middle of the night to go to the bathroom, and then I would have a really hard time going back to sleep. I couldn't resettle. And that would be unfortunate because I think also the waking up frequently to use the restroom is also another sign of, perimenopause, like not being able to hold your urine I mean, it's not even like one time a night. We're talking 2, 3 times a night to get up to go to the bathroom. So that is also disruptive to the sleep. So for me, those were the main reasons that I went on it. But what happened when I upped the dose of the estrogen was I ended up having, I call it the period from hell. It was such a long period. I felt like it was never going to end. And it really like depressed me because I just got sick of having to change my pads and tampons. I also had an embarrassing situation in a Chipotle restaurant where I got up and I thought I was done with my period because, sometimes you spot and then you're like, oh, I'm done. I'm not going to wear anything. And I wasn't done. I stood up to go get more soda or something and I actually dripped blood on the ground. And my husband saw it and like wiped it up. And we tried to like, oh, no big deal, just bled in Chipotle. But for me, I'm like, this is not normal. Like, this is abnormal. And I just remember feeling embarrassed and angry that, my daughters would joke, like, you've been having a period for a really long time, mom. How do you still have accidents? But it's because the flow was also really heavy. So that was also another symptom was the heavy flow.
Yeah.
But anyways, I ended up going off.
How
We
long were
talked
you on it?
a month.
Yeah.
Oh, a month. But that bad period was enough to do me in. So
Yeah.
I decided to go cold turkey off. I stopped everything. I stopped the progesterone. I stopped the estrogen. And I promised myself that for the entire month of February, I was going to prioritize everything else that I had read out there that was natural. So movement, stress reducing activities, and healthy diet. And I also drastically cut back my alcohol. I don't think I drank at all in the month of February. I really tried to see if that made a difference. And so for me, it did make a difference, but it wasn't sustainable. I mean, I was like walking in the morning, going to the gym, and then doing yoga at night. So even though that was great, like how can I sustain that and function? So I cut out the walk in the morning. I'm still, because it's also dark in the morning at 6 o'clock now. I still do yoga in the evenings before I go to bed. I just do a video. I still go to the gym. I still eat healthy, and I have really reduced my alcohol intake. I only drink if I go out with my girlfriends. I don't drink at home. I don't drink if I go out on dates with my husband. He's also not a drinker. So those are the things that I have done now. Whether or not I'm going to try it again, I don't say it's not in my future. I just feel like I can't have a period that lasts, I think it lasted 17 or 19 days. I just can't. For me,
Yeah.
that was very depressing.
Yeah.
It
Yeah.
got old super fast.
Yeah.
So,
So I think that's great because not everyone is a candidate. Not everybody wants to go on it. Not everyone is open to it. But I will say that it does take a while for your body to adjust to the new hormones that you're putting into your body. And consistency is key. Like you have to be consistently taking everything. You cannot skip. You have to make sure your patch is changed all the time. And like our lives are crazy, right? But consistency with any kind of hormone replacement therapy is very important. And you do have to wait. I think the magic number would probably be 3 months. 3 months is where I think you'll feel the shift. Because also, when you start hormone replacement therapy, for me specifically, like I had all this water weight that I was holding on to. And one day, and I remember when I learned about this, when it happened to me, I was like, "Oh yes, this makes sense." All of a sudden, everything will just drain. Like you'll just not hold on to it anymore. You're just going to pee it out and pee it out one day, and it was absolutely true for me. And I know that gaining water weight or gaining any kind of weight is scary for people, especially during midlife, because we're already battling weird weight. It's shifting. It's going here. It's going on our backs, our bellies, our midsection, places we don't normally ever have an issue with weight gain. So that part is you have to wait it out. It's a good 3 month transition. That was my experience. So I guess I can talk about my experience with it. I think I've had symptoms for years and years and years. I've had migraines. We've talked about this before, I think, in some other episodes, maybe Welcome to Crazy, but I've had migraines for years. I've been to every doctor about them. And I have my dry eyes is awful. I still have dry eyes. And anxiety, panic attacks, rage, irritability, dry skin, pain in like my uterus area where it just feels like someone literally I was a punching bag. I can't even, there's hair loss. I like was losing my eyelashes randomly. And I always had great eyelashes. It really bummed me out. I'd put my
Do you think
mascara on, I couldn't even find my
eyelashes?
eyelashes anymore. So those were my symptoms. And I know about hormone replacement therapy, but I can't prescribe myself, even though I prescribe it for patients. I can't prescribe it for myself. So I went to an online women's health portal and made an appointment and got on it right away. And I have a history of melanoma. So I've had skin cancer twice. So I always thought I was not a candidate. And to be honest, it might be a little bit more of a risk for me, but that's a risk I'm willing to take because if I was miserable, this is how I'm justifying it in my with my health history. Not everybody needs to justify it because it may not be for them. But if I had 10 years of being horribly moody and miserable and depressed, and who knows what could have gone on in those 10 years, I could have gotten a divorce because no one wanted to be around me. My kids would hate me. Like there was just, it was not a reason to stay in that situation. So when I started the hormone replacement therapy, I remember I was on it for 3 weeks and my husband turned to me and he's like, come here and give me a hug. And he never really does that. I was thinking, why? And he goes, well, you've been just really like calm and sweet lately. And I haven't heard someone say that about me in a while because I am not calm and sweet anymore. I'm always rageful. And I was like, and I looked at him like, oh my God, I've been on hormone replacement therapy for 3 weeks. And he's like, so he's never fought me about taking it because I felt a difference right away. I did feel like a little water weight, but I started sleeping better. And my prescription was 200 milligrams of progesterone and the 0.0375 patch I changed twice a week. And then after that, probably 3 months later, I decided to go on testosterone cream. And I do that every morning too. So that gives me energy. I feel great with that. Sleeping, sometimes I go down to 100 milligrams because if I take progesterone, sometimes if you take too much progesterone, you can feel kind of too depressed, like it just kind of subdues it a little bit too much. So the nights that I can feel my cycle when I'm low in progesterone, then I up it to 200, and then most of the month I only take 100 milligrams a night. So that's my story, and I'm still on it. It's a game changer for me. I can't live without it. I don't, if someone ever told me that I would have a bigger risk later on, I think I'd take the risk because I just feel so much better and happier, and people can be around me. Like, this is the saddest thing I have to say is my sweet little daughter would sit next to me and want to curl up, and my skin would crawl because I didn't want someone next to me. Or my husband would just want to be sweet and kind and sit next to me, and I would just like, get away from me. And it's so sad that I just never want to go back there again.
Yeah,
So that's
no,
my story.
I know
Yeah.
exactly what you're talking about. And I had some of those same exact symptoms when we were talking about this back in December. I felt the same. Like I would sit on the couch, and if someone would come sit next to me and want to be like in touching range of me, my first thought in my head, I didn't say it out loud, but my first thought is like, why? Why do you have to touch me? Why can't you just stay on that side of the couch? And it's not because I'm not affectionate, because I think that that is one of my best traits. I have always felt very affectionate with my friends and my kids and my husband, but I think, yeah, it would make me very irritated. I guess it was also another instance where I felt someone needed me, and I think I got to a point where I was really tired of being needed all the
Absolutely.
time.
Yeah.
Anyways, okay, well, let's go to research and evidence because I think that's important for people who are considering going to their, nurse practitioner or their physician, OBGYN, and asking about hormone replacement therapy. It's good to go in with your own research and evidence, right? So that when the doctor says something, you can actually say, oh, yes, I've also done my research. So, what does
Yes.
current research say about HRT and its benefits?
So there's several studies here. So you guys can write them down if you're listening and you're able to write these down and then go do your own research. But there's
We
the
can link them
latest
too.
one.
We could link them in the show notes too.
Yeah, we can link them. That's right. The North American Menopause Society position statement, and that's from 2022. It's called the NAMS. It's the Menopause Journal, and the summary is that endorses HRT for healthy women under 60 within 10 years of menopause to relieve symptoms and reduce risk of osteoporosis and possibly cardiovascular disease. So, not only is HRT helpful for your symptoms during perimenopause, but there is now studies coming out showing that it reduces the risk of osteoporosis, which means
Which is
that your
huge.
bone health, which is huge because we need to be able to walk and not fall and be decrepit when we're older. So that's huge. And also, the number one killer of women is cardiovascular disease, heart attacks, and strokes. This also, they're saying that HRT can possibly decrease that cardiovascular risk as well, which makes sense if you think about it. Because most people eat healthy. It's like, I know you, Renee, you eat really healthy. You have a great diet, Mediterranean diet, but you can't help if your, what am I trying to say? Midlife moment.
Um,
If you're, my gosh,
my health, my own mom. No,
no, if you're, oh my God. So you have to take a statin because your, your cholesterol, there we go. So in midlife, your cholesterol can just go up and it's not because you're eating
mine
differently.
did, by the way. That's
Exactly.
interesting that you brought it up. Mine did go up when they took my blood work. And that was another reason why I was going on the HRT because my cholesterol for the first time ever in my entire life was like flagged high. I couldn't believe it. I was like, I don't even really, I never eat red meat and I exercise all the time. And like you said, I have the Mediterranean diet for the last, I don't know, 30 years of my life, maybe
Right.
more.
So there's some things that you're not going to be able to control. That's just what's happening. So with these studies, they're finding, great things for the future. Also, some studies are finding cognitive health
Hmm.
increases. So if your hormones, because there's estrogen in all receptors in your entire body. So if you decrease the estrogen, things are going to fail. If you keep it to where it's needed and all of your receptors are getting the estrogen they need, your brain, your bones, your heart, everything, that you're going to be thriving instead of declining. There's also the International Menopause Society IMS Global Consensus 2022 journal supports use of personalized HRT as safe and effective for symptom management and long-term health in early perimenopause and postmenopause. British Menopause Society offers practical clinical advice supporting individualized HRT, especially body identical hormones, which is bioidentical, safe option for symptom relief and long-term health. So they're finding a lot of these studies are showing long-term health and benefits with HRT if started within perimenopause, like I think it's like between 40 to 55, depending on when you actually go into menopause, which you'll never know if you start HRT. You can never pinpoint when that's going to be when you actually are in full menopause. So these are all great studies. I would say do your own research. A lot of physicians and healthcare providers do not study this. They don't get education when they're in med school. Even OBGYNs, I think they get like 2 hours of menopause medicine, and that's not enough. And there's a lot of practitioners out there that are still hung up on the 2002 Women's Health Initiative study that was debunked. Doing your own research and talking to your practitioner who is up on all of the new developments is best.
Yeah. I think that's really good advice too, because I've seen, OBGYNs who I think the best word to describe the situation for me is dismissive, making it seem like it's normal that I'm having these symptoms. And I'm not trying to say it's not normal, but to say it's normal that you're going through this because a lot of other women are going through the same thing when they go through perimenopause and not offering some options for relief. I feel, and I'm not a man hater by any means. I'm not saying that to say that I am, but I feel like if men were going through these same symptoms, there would 100% be solutions. And it wouldn't be something that was shamed or frowned upon or discouraged. So I think it is important to know the research, educate yourself, do what's best for you, try things out. I don't know that my story is the best example because I didn't consistently do it for 3 months. And I think you're right, Danielle, that I didn't give it a fair shot. But I also, when you said, you have to weigh not the pros and cons, you said the
Risks and benefits. Yeah.
benefits and risks. So for me in February, it was a really like I went inside in February and I went into like Renee zone. And that whole month I focused on me and how I felt. And I realized that the symptom that bothered me the most about my perimenopause is my heavy periods. That is number one. And then it was followed very closely by irritability. Well, February was my month of trying to treat it in natural ways, right? And it did help to drink less alcohol, and it did help to move my body more, and it did help to prioritize journaling and
Yeah.
reading again and doing yoga at night. And I started to feel better. And part of me made peace with my period. And I know that sounds really weird, but ever since then, I have had better periods. They've been better each month. And again, I'm going to knock on some wood because I don't know if it's just a cycle and if it's going to come back, but I can do a normal period, 5 to 7 days. What I can't do is when it spans so long of my month and it's so heavy and it wipes me out. And the other thing that I did that I think is important, and I think you are the one who gave me the advice to do this, it was either February or March, I had really bad cramps. And I think I texted you in the morning and I was like, yeah, I'm having some really bad cramps. And you said something like, you should just take the day and prioritize you. And if you want to lay in bed all day, just lay in bed all day. And I remember thinking, she's so right. Why do I need to be a superwoman? It's Saturday. It was Saturday. And so for me, my mindset shifted and I was like, it's Saturday. I have the ability to lay in bed all day today. And so that's exactly what I did. I took the
Yeah, and
day to,
everyone can just leave you the alone. Your body's going through a lot. Like you said the other day, what was that yoga thing the other day? You said you went to yoga, and what was the first thing the person said to you, the yoga
yeah,
instructor?
the yoga instructor, we were in the middle of a flow and he said, it was kind of a, tough position that we were in our bodies. And he said, I want everyone in this room to take a moment and acknowledge your body and all the shit you have been through together. And it got me so emotional because I just like, I don't ever do that. Like, I'm always picking my body apart and saying bad things to my body and looking in the mirror and saying, your stomach is showing there, or fix that, or your posture, or your this. And in that moment, I was like, he's so right. He's
Yeah.
so right. And I just wanted to give my body a hug,
Yeah.
really, because
Yeah.
we've been through a lot together. And I honored my body that day. And I stayed in bed and I watched shows and I relaxed. And I even did a yoga video on menstrual cramp yoga. It was like 20 minutes, nothing big. The next day, I felt better. I made peace
Yeah.
with my period. And I think that was a huge turning point for me and my personal journey.
Yeah. You don't know, Renee. What if your period stops next month? We don't know what's in store, right? You could be at the end of it because
Mm-hmm.
you've been going through perimenopause forever. The average age, like I said earlier, is 51.
Right.
That's in
It could
menopause.
be right around the corner.
But there's also some things to think about with HRT, longevity wise, keeping your bones and brain and cardiovascular risks, all of that stuff. That's what they're saying that is helpful. So if you're thinking about it, just make sure you do your own research and always talk to someone or that knows your history and takes a lot of history from you because it's really important and you need to make that decision together. This is between you and your doctor or your nurse practitioner or whoever it is because you guys need to make that shared decision on that.
Yes. Well, I think this is a great lead into our rapid fire questions. So these are going to
Okay.
be a little bit different. So we did rapid fire with our previous guest, Dr. Noriko, and that was such a great
Oh,
episode.
yes. That's kind of fun.
So this is going to be myth or fact. Okay. So I'm going to make a statement and you're going to tell me quickly whether or not it's a myth or fact. Okay. First statement is HRT, hormone replacement therapy, causes cancer.
Myth does not
You
cause cancer.
Yes, does not. We learned that in the very beginning, which is so good to know. Myth or fact, you can't take it if you've had migraines.
This is a myth. I've had migraines like forever. So again, risk and benefit, it depends on your migraines and all of that. So you need to have that history with your doctor. But myth.
Okay, myth or fact, testosterone is just for men.
Oh, this is such a myth. No, we need testosterone. No, no, no.
Myth or fact, you'll gain weight on HRT.
This is kind of like at first maybe yes you might gain some water weight. There's a transition. Hang in there though, because actually you're gonna feel like it all goes away, and then you're gonna feel like yourself because you're not holding fat in certain spots anymore. And also, I forgot to tell you this: muscle building, eating protein, and lifting weights at least 3 times a week is really important. You're gonna feel when your hormones and everything is leveled out that your muscle mass is going to come back. And so you just need to make sure you're eating good protein amounts. It should be, I think it's like however much you weigh, that's how much protein you should be eating in a day. And
10 grams.
then weight, yeah, that's right. And weightlifting 3 times and just getting out there, even just walking, just exercising, and it's really important. So I just needed to mention that.
No,
So
that's
you
it's
may
and
gain
it's
weight, but that doesn't mean it's fat.
right.
It
That's
doesn't mean
true.
it's fat. It actually will go to muscle at some point and water weight will go away.
You have to wait until menopause. Myth or fact?
Myth. Absolutely don't wait till menopause because your symptoms are all prior to and then when you're in menopause. So you want to get a hold of it before.
And this is a really good one. HRT is just for hot flashes. Myth or fact?
Absolutely not. So I don't experience hot flashes. I not yet, knock on wood. That's not one of my big ones. So no, but it definitely helps if you do because I know how uncomfortable they everyone has said that they are.
This makes me laugh. HRT will make you grow hair in weird places.
I think we already grow hair in weird places if we're not on
Thank you.
HRT. If anyone's getting the beard down here, I had that way before. I think that's just that might be the loss of hormones. That part I don't know, but no, that's a myth. I think they're speaking testosterone. If you take testosterone, that you're going to get hair. No, that's a myth.
We
We're
already
not.
get
We're
hair
not giving you that
eventually.
much.
Mentions, yeah. Okay, two more. Once you start, you can't stop.
That's
Myth or
not
fact?
true. That's a myth. You can stop at any time.
And then HRT is a magic fix. Trick
Nothing is a
question.
magic bullet. There's nothing. And I know we all want it to be just like, was it you earlier that was saying you're the pillar of health, right? You eat well, you exercise, you're very mindful, but menopause is still happening. Perimenopause is still happening to you. There's no quick fix. It's not going to fix it all. It's going to be helpful for you to manage and get through this time in your life. And then the studies are finding that it's going to be helpful for your body functioning in the future. It's not the magic fix, but it's a tool in your tool belt.
Yeah. Well, and also, coming out of the episode that we did last week with Noriko, Dr. Noriko, she talked about acupuncture and functional medicine. She talked about Chinese herbs. She talked about the castor oil
Yeah, that's
on a
right.
paper towel, the wrap. She talked about acupressure. She talked about massage. She talked about a lot of different things. And like you said, this is just another tool and resource that we have to help with these symptoms. And it doesn't mean that you go on hormones and you do nothing else and you're going to feel good. Like you said, you have to be healthy. You have to make good choices. You have to prioritize your health. And Dr. Noriko said that too. And it's all about balance too. So it's nice if you can have a balance and be open to some of these solutions and at least do your research and find out what works best for you.
Yeah.
Because
Right. I'm so glad you talked about the acupuncture because that's another holistic way you can go if you don't want to do HRT or if you are on HRT and you want an addition to have some wellness. Like it can all mesh together. But again, tools in our tool belt and education and knowledge and, let's give women the education and things they can look into because why suffer? There's so many things you can do.
and also I think it's important to note a lot of these things that we're talking about give you hope. And when you feel hopeful that you're going to feel better, that alone is so powerful because if you feel hopeless, it just goes down the drain from there. And I am happy that, I have been more open to prioritizing my health in midlife. I think that's a really good thing about midlife is we are kind of shaken by these symptoms to be like, do something different, try something new. Don't just let yourself go down the drain. And
Don't
so
be miserable. I mean, it takes work. It all takes work. It takes work to be well. It takes work to eat well. It takes work to work out and be healthy. It's exhausting. It really is to be a human sometimes. But
but like pick your hard, pick your
yeah,
hard, right? Like that,
right.
choose your hard,
Yep, so
being
true.
exercising every day is hard. Well, so is being super
Sick.
overweight, right? Yeah.
Sick. And being overweight, that's why hormone replacement therapy can help is being overweight, getting type 2 diabetes, getting osteoporosis. All these things lead to getting cancers. There's so many things that can happen if you don't take care of yourself.
Yeah, it's
So
true.
it's effort and energy and dedication and consistency for anything in life that's going to be beneficial.
And it's all about healthy aging gracefully and longevity, because we're not dead. We're not on our way to dying. We're on our way to our next chapter in life. We want it to be, vibrant and healthy and we want to be able to walk upstairs and not need help going to the toilet. And that's going back to what we were talking about in the very beginning about prioritizing our health now. And Dr. Noriko said that too. So I think it's just really, really important to have these conversations and to open the door for future conversations about prioritizing our health in general and
Yeah.
honoring our bodies and what it needs and giving our body what it needs.
So this is a little late, but I forgot to talk about this. So dryness in midlife is
Mhm.
everywhere, and that's one of my biggest symptoms. Dry eyes, dry skin, dry face, dry vagina, everything's dry.
Dry
So
mouth too, right? Have you said you
dry
have dry mouth?
mouth.
Yeah.
I actually went and was diagnosed with Sjogren's disease because everything was so dry, and I think it's part of perimenopause. Again, that physician didn't say anything about hormones. But anyway, so I use the estrogen ring. It's a vaginal ring that you put up, insert it into you, and you leave it there for 3 months, and it delivers its estrogen to your vaginal area, and it helps with moisture. It helps with a lot of women get UTIs during perimenopause. I think this was Halle Berry's story, if I'm saying it correctly, but she, on the Oprah special, she had mentioned that she was in this relationship and they had this wonderful night of sex. And then she woke up and she was so swollen because of, I think, all the dryness. And she went to the doctors and they said, "You have herpes." And she's like, "What?" And so she went back to her partner. He's like, "You have herpes." It was this big thing, but they both got tested and no one had herpes. It was just because she had severe dryness and it had chafed and gotten so bad that it was so painful. So that's her story. So I that's the estrogen ring. It's not covered by insurance. Most insurances it doesn't cover. It's expensive, but for me it was worth that price because I feel way less dryness down there. It's been great. Also, I use estrogen face cream every night. So I just put it on my face and my neck because you need estrogen in your skin, and I feel like I'm lacking everywhere. So I use that as well. And I think it helps bring that moisture back, and I don't have like that dry, crinkly skin. Both of these are not systemic. So the estrogen, because I'm on a patch and progesterone, it doesn't mean that it's going into my blood system. So I'm not adding too much estrogen. So it stays right where I put it. It's going to my face, my skin. It's not going through my whole blood. So I just wanted to mention that because those are game changers as well. Those are options. Talk to someone about that if you're having dryness. Libido is also something that's can be helpful with HRT because I know that a lot of women face that too in midlife.
Yeah, well, and I think it all stems from, like you said, not sleeping, and then you're irritable, and then you're cranky, and then, if you're not feeling sexy because you put on a little bit of weight, or
Yeah,
your body doesn't feel like it's your own, and,
right.
it's the last thing on your mind, but you also want to connect with your, partner in that way.
Yeah. And we would like
HRT,
sex. Everybody wants sex, right? Not just for men.
right?
We all want it. It's just a little figuring out what we need, what our bodies need. A little tweaking here and there.
And yeah, and you can't really make peace with.
I didn't say twerking, I meant tweaking.
I know you said twerking. We're gonna be talking about twerking next week, folks. Next week in our next.
And twerking's good too. A little twerk in
Twerking's
there.
so good. I can't wait to talk about twerking. Who would have guessed that I would have enjoyed something like that? But we can thank my daughter for that.
Yes,
Anyways,
thank you.
well, this was so informative. I want to thank you for spending the time to share with our listeners everything that you know about HRT, hormone replacement therapy, all the different, methods and delivery, and also who's a good candidate and who might not be a good candidate, and explaining why health history is so important and being honest with your doctor when you do go,
Huge.
share.
That is huge. Thank you. Don't leave anything out. It doesn't benefit you.
No, it doesn't. And you want to make you want your practitioner to know all those things too, because it's only fair, right? They can only make a recommendation based on what you've shared. And you've told me that too when I go and see my OBGYN, because I had to see a new one because it was really hard to get an appointment. And you
Which
said,
reminds me, we need to
you're
talk about because of your heavy bleeding, you needed an ultrasound. So that's very important. That
yes.
hormone replacement therapy, you want to make sure before you start it that you are safe and healthy and that there's nothing else going on. So that's huge. You did get an ultrasound, so that's good. And then also I needed to touch on I have had an ablation. So that means that I don't bleed anymore, except there's a caveat there. I was bleeding every day for 30 days before I went on hormone replacement therapy. So, but now I don't have a period. I've had an ablation 3 years ago, and so I don't really have a period. And that was done because I was bleeding so much.
And can you
And
explain too what an ablation is?
it's basically cauterizing your uterus. So it burns it down in plain terms, so you don't have a period anymore. And the goal is that you have the ablation within, I think, a 10-year mark of when you would go into menopause, so that it takes you, you're not bleeding. And then once you hit menopause, you're not going to bleed. So that's the goal. So you don't have periods anymore. You don't have that heavy bleeding. And to be honest, it's not for everybody, but it was for me. And it was a life changing experience. And if you have someone that you can talk to your OB about doing an ablation, if you're a heavy, heavy bleeder, it's amazing. It was a really great, simple procedure. I did go under for it though, so that's not fun. But other than that, it was simple, easy recovery. Again, that was my experience. It doesn't mean everyone's experience is like that. Ask around, what are the risks and benefits and things like that. So I just wanted to make sure that we're giving you all of the background and the information so that you can make a informed decision on what you want to do and what's out there.
And what you even want to just find out about because maybe you didn't know that these were options. So,
Right.
all
Exactly.
right. Well, if someone is listening and feels like a hot mess, literally, what should they do next?
Okay. I if you want to find a practitioner or doctor who specializes in menopause medicine, visit the Menopause Society to find a certified expert in your area. Another option is to check out MIDI Health, which is MIDI for virtual menopause care. And then if you're in San Diego, you can always meet with me. I'm at Coastal Plastic Surgeons in Del Mar. So I charge for a consultation. So does MIDI Health, but I think MIDI Health also takes insurance. And you can get hormone replacement therapy covered by your insurance. The pellets are not covered by insurance, so that would be a whole different way. And testosterone is not covered by insurance, but you can definitely get progesterone and estrogen covered by your insurance. And some of your practitioners will be great at menopause medicine, but you just have to find an expert because again, a lot of them don't get any menopause medicine education. That's all what they find kind of on their own. And the Stanford Menopause Society is an excellent resource for information as well. So if you guys have any questions, if we didn't cover anything, because sometimes we forget, as you can see, I had a
Sometimes
complete
we forget. And
problem in the middle that I couldn't remember even a name. That happens a lot to me. So you
midlife
can,
moment.
yeah, you can email us your questions, or I think can they make a comment on the podcast and ask a question?
That's
I
a
don't
good
know.
question. I don't know.
If you can, let us know.
I know we did get an email with a suggestion for a topic, so that was great.
Oh, good.
Yeah, please reach out. We check our email all the time and we are really trying to create episodes that are meaningful for you as listeners. Also, I want to give a little tag for our next episode. We are interviewing the dynamic duo behind Madhouse Dance in San Diego, and dancing was something for me that really helped with my stress level, and it really opened up a whole new side of me that I had forgotten about because I used to love dancing when I was back in my heydays in college. And life happens and how often do you go out dancing? But I was dancing three times a week and I still go to classes at Madhouse Dance and I'm so excited that they agreed to be on Crazy Stupid Midlife. So it is the studio owner and also the studio manager and we experienced Madhouse Dance together a couple weeks ago. It was amazing. It was
It really
fun.
was. It really was. 2 hours of dancing. It was amazing. Even my chiropractor the next day was like, if you can at your age do 2 hours of dancing and you're just in a little bit of pain the next day, that's pretty good. So I thought he's probably right.
Yeah. And following the choreography, which is not easy. So it was a great experience. But they'll be with us next week. We can't wait for this interview. And a final message, too, that I just want to add is that menopause isn't the end. It might just be the beginning of your best damn chapter. So we just want to
Yes.
keep pointing that out because we want to also infuse a lot of positive energy into this midlife shift in our lives because I think that that's super important.
Yeah.
Anything else you want to add, Danielle,
I just
before
want to say thank you for listening and thank you for listening to our stories. And we're being pretty raw and open sometimes. So hopefully you enjoyed listening to what we have to say. And, we're just going to keep on doing it until we don't.
I know I'm like questioning now that Chipotle story. Maybe
I
that
don't
was
know. I
smart.
think you actually, I think it was we've talked about that before. I don't know in what episode, but I think it's
Did
there.
I bring it up before? That's really funny. Of course I don't remember because I don't remember anything. All right. Well, thank you
Right
all
there
for
with you.
listening. We really appreciate your support, and we're so happy to see so many people downloading episodes. It's great. We're so thrilled
Very
to
unexpected. I'm excited about it.
yeah, thrilled for sure. So, until next time, stay healthy, stay curious, and just a little bit crazy.
See you then.